our board secretary, but has a different title. Sorry, Lynn.
Clerk of the board.
That's all right. Clerk of the board.
Clerk of the board. There we go. Sorry, I apologize.
No, that's okay.
The position that we've had the longest. And Lynn has been with us for a few years now also. So I just wanted to introduce the staff that's with us today, and we appreciate the time that they put in, the dedication they have to the consortium. So Kylie, I'll move to the next page. If anybody has questions, feel free. I think they can use the chat, Kylie, if they have questions or anything, or can interrupt me. So our agenda today is going to include, what is the consortium, the fact that it's a self-funded multiple municipal cooperative. We're going to talk about membership, annual municipal member expectations that we want to encourage, the governance of the consortium, the role of the board of directors and the different committees that we have. Kylie's going to go over some of our other services that are available, our voluntary services. Of course, we have billing and enrollment procedures. So we're going to jump into all of these different topics. So our first topic is what is the consortium? And some of you, I'm sure, have heard pieces and parts to this. The consortium was formed in 2011 as part of a shared services grant. So that's how we came together with starting out with the 13 member municipalities here in Tompkins County, and have grown since then. Part of our mission was to be an efficient intermunicipal cooperative. We wanted to make sure that we had high quality, cost stable health insurance for our members, being the municipalities, and then the employees and the retirees, which are our participants. A piece of that kind of came from the member municipalities in the beginning coming together because we were getting health insurance premium increases in December, and our budgets had already been struck and was causing havoc for us. So one of the things when we came together as a consortium and developed our mission and vision was that we also wanted to be able to have stable rates as much as possible, have good cost and efficiencies in our practices, and to be able to produce rates out to municipalities before we struck our budgets, and so we had more information and was a part of that information. So as part of our vision, we were coming together to administer operations, collaborating on claims, and our providers and our employees, and just making sure that we have a trustworthy organization. And then we've added over time promoting the preventative health care, and well-being of our members. And that's one of the things that Kylie will be talking a lot about at the end. And I should say, Kylie, or Lynn or Jen, if anything, I forget my notes from Elin, please feel free to jump in and say anything. I won't be offended at all. Okay, so the Health Consortium is a self-funded multiple municipal cooperative. Of course, we call it a consortium, but we are all coming together. We are governed by New York State insurance law under what we call Article 47. So you'll hear us say that often. That is what governs how we can come together and offer health insurance. We are able to come together as municipalities under general municipal law, 5G. That's what allows for the shared service piece to it. And through that, we developed a municipal cooperative agreement, our MCA, that you should have already seen at some point. And that is what kind of guides our operations. And Lynn should have sent you resolutions or the municipal cooperative agreement, and you should have sent in resolutions adopting that. Some other things that are interesting is we are obligated to adhere to certain New York State mandates that go into the insurance piece to it. Example of that is as a large member group, you have to offer COBRA for 36 months instead of 18 if you were just a small municipality. One of the key things for the consortium is that we are attempting to pull together a large risk pool, which helps spread out the claims and to keep our premium rates low. Hopefully, we'll keep our rates lower than if you were purchasing benefits directly from Excelis. So our municipal members have a responsibility, and that's one of the reasons why we're here today is kind of go over some of those responsibilities and opportunities you have to be involved in the health consortium. The municipal members are owners of the organization, and they are also responsible for writing our benefit plan. So our plans, we do work in conjunction with Excelis, but they are our consortium plans. There is a responsibility to fill the voting seats on our governing board of directors. And it does include also some labor in our government structure, which is required under Article 47. And then to be considered part of a large group health insurance coverage. So most of us came from smaller municipalities. And so we were part of that small group insurance. So now we're part of a large group health insurance coverage. So another example besides the COBRA that comes into play is with Medicare, will be a secondary to any active working employees who's enrolled in Medicare, which is a little bit different than if you were under a small group. So it really doesn't matter if you have one employee or 100 or 99, let's say, you're now considered a large group. Okay, so who is the consortium? We started out with the 13 originally in Tompkins County. And then we grew to include all 17 in Tompkins County. Also had interest from surrounding counties. So we went with our 6 contiguous counties, which was Cayuga, Chemung, Cortland, Schuyler, Seneca, and Tioga. And then August 21st, the Department of Financial Services, DFS, you will hear us say that several times, approved a new certificate of authority, which is what gives us the authority to expand into other areas. And at that time, we included Broome, Chemung, or Broome, Shenango, excuse me, Madison, Onondaga, Ontario, Oswego, Steuben, Wayne, and Yates County. And then just in 2024, we had also requested the addition of Livingston and Monroe counties. We have not quite received our certificate yet from the Department of Financial Services, but that we're expecting to come soon. Unfortunately, we can't offer insurance in Livingston and Monroe until we get that. At this point in 2025, we have 78 municipal partners, so it's kind of nice to go from 13 to 78. And we have 7,800 covered lives. So to hear Elin and Kylie talk about it, our covered lives mean belly buttons. That's the number of people covered under our insurance. So your employees and their spouses, children are all included in that 7,800. And just to, we had to have 2,000 to begin. So it's great that we've grown to that number. This is a nice little piece of information. This shows all the different counties that we have members in. Our 14 new municipalities that came in 2025 are all highlighted in bold in the different counties. So certainly you can see the Cayuga County, Cortland County, some of them we have quite a few. And then some of our newer counties, we might only have one, but we're certainly growing. And we're trying to do it very slowly and carefully to make sure, number one, we can handle the growth and to be able to keep it organized and keep our rates stable. Kylie, anything you want to add so far that I haven't forgotten or that we're not going to cover?
No, you're doing great. You're doing
All right. Great. So we wanted to show this. This is the Health Consortium's organizational chart. The beginning part obviously is our board of directors. So every municipality has one representation, one seat on the board of directors. You do have the option to have an alternate for that. So we do ask when you let us have the resolution of who's your board of director member that you can also have an alternate. Part of that board of directors also includes 10 labor seats because we are required to have labor on our board of directors. So the board of directors are basically the ultimate and make the decision on things. And then we have the executive committee, which is kind of the committee, which I'll go into a little bit more, that runs the organization on the in-between. Working with those, we have the executive director that is kind of the lead for the whole organization, obviously. The clerk of the board, Lynn, I messed up her title, is the key person, the secretary to the board and executive committees and does all of the secretary aspects for us. And then, of course, we have the finance manager, benefits manager, Kylie and Jen. And then we have our committee structure that falls under the executive committee. These are the joint committee, which I'll go over a little bit more. There's two different kinds of members in the joint committee. One is municipal employers, the management side, and then we also have collective bargaining units, which is the labor side. We have the audit committee. The audit committee only meets once a year, so that's the best committee to be on. I'm just kidding. So the audit committee goes over the audits, the finance committee, and I'll go over each of these a little bit more. We have our operations committee, claims and appeal, and then our nominations and engagement committee. So all of these committees are made up of municipal board of director members or a designee. The staff works with our third-party administrators. We have Excelis Blue Cross Blue Shield that handles all of our medical and prescription coverage. We also have CanRx, which you might not know that much about, but CanRx is another source for our prescription, brand name prescription drugs, and provides that to us. And then we're able to keep our rates low because we hire professional support staff as we need it. So we have our plan consultants, which is Losi and Cahill. You'll hear about them during different times. We do have a hired actuarial and investments company. We have legal, finance and auditing, and then our information technology piece to it. So being able to just purchase these services as needed helps us keep our rates low. And then I will, we move forward, go over this a little bit more. Governance, the role of the board of directors, we have certain expectations, let's say, of the board of directors. So like I said before, this is one member from each municipality. So it's on the board of directors. We have our required meetings. The first one is our annual educational session that we try to give you a heads up on where the budget's going to be and provide other educational information. That falls in August. And we have our board of directors meeting that falls in September. That's our annual required meeting. The board of directors meeting, we do require, or we have to require people to be in person. A lot of our other meetings, we can incorporate some Zoom opportunities, but the board of directors meeting does require in person for our quorum. And our joint committee meeting, which is held 4 times per year, that starts in May, and meets, pretty much through the summer. That one, we do need labor reps and we need management to have a quorum. They have 2 different quorums, just to keep things interesting. And the joint committee is one that lots of times a benefit specialist, or benefits, coordinator will serve on the joint committee because we're talking more about benefits. So it doesn't always have to be the board of director member, on the joint committee. But we do, hope to have all labor, represented on that. So if you have a labor group, they can sit on that. And that is mostly done through Zoom at this point, for the most part. And then today a little bit, we do have some benefit clerks training. So those that are going to be managing the benefits, we have 2 meetings a year. One is before open enrollment, in November, so we can get out information to the benefit clerks, about any changes that are happening, with any of the benefits, and just information, happening that way. So those are really important meetings. Those are required meetings that we really need to have membership, attending. And then, things that are really important for, your employees. There is some required employee engagement, that's important. We encourage, that every municipality host an open enrollment in November. We do need to have changes through to Excelis, before December 1st, right, Kylie? Typically.
I asked that the changes be into me by November 30th, so I can get them in and turn them around. I left myself wiggle room, of course, but, if they come in any later than December 10th, people won't get their cards in time for the new year.
Right. So typically, November is the month that's an open enrollment, month. And that just means that you're allowing your health insurance eligible employees that opportunity to make changes to their coverage. They can enroll or terminate coverage. This is kind of their legal opportunity time to, add somebody to the insurance or change it. Some of us only have one insurance plan, so that's, not typically a big deal. And these changes are all effective January 1st. So, this happens in November so that, Excelis has the time to get cards out, make those changes, so that it's, hopefully seamless on January 1st. You also have to offer COBRA coverage to all employees that are leaving coverage. We do have a provider, Lifetime Benefit Solutions, who will work with the small groups to make sure that COBRA, process happens. Any large groups, though, we are kind of on our own for that. So it's really important to make sure those COBRA notifications happen when somebody leaves coverage under the municipality. And then required documentation submission, that is really, really important, is that the chief executive officer signs the municipal cooperative agreement annually. This is typically due by December 1st. So the board of directors in September approves the municipal cooperative agreement, and it goes out to each of the municipalities to sign annually. One of the reasons why typically it needs to be signed annually is the fact that anytime we add a new member municipality, it changes the MCA. And then Department of Financial Services requires us to send those approvals on from each municipality. So this is when Lynn gets to have a whole lot of fun organizing a lot of paper. And so we'll go over that, but you will typically get examples from us on what a resolution should look like, what the forms are that we need to have back. So there is help there as much as we can. But we do need to have those resolutions signed and returned. The other thing that is required is our code of ethics. Annually, the director and the alternate will sign a code of ethics This is due by March 15th. This comes out electronically and is pretty simple and easy to turn right around to sign and get turned right around. So that's another thing that Lynn's responsible for. Under the Municipal Cooperative Agreement, or our MCA, this is our guiding principles. This is kind of what runs the organization. It is the shared service agreement. It does, as I explained before, need to be signed and approved by resolution when you join, and then every year thereafter as we add new members. The Department of Financial Services is the agency that we work with at New York State, and they are very, very specific on how the process needs to happen, what they're looking for, and what the forms need to say, and how they need to come across. So as I said in the previous slide, we try to give some direction and examples and instructions on how to do that so that we can get all that through. So as I said earlier, we have 70-some member municipalities, so that's a lot of resolutions and signatures to get. So we'll go over now kind of your involvement, how we are hoping to get involvement. This is, I guess one thing I can say is this is your organization. It is you're buying health insurance, but it's also your organization. That's the key thing, is we get to have some say in the aspect of how it runs. So required municipal representation, as I said, the board of directors, there's one vote from each municipality. You have a director, and then you can have an alternate. On the executive committee, Lynn, how many people are on the executive committee right now? Is it 13 or 15, something in that area?
Sorry about that. We have, let's see, on the executive committee, we have 12 individuals.
Well, okay. So that executive committee is, if you are serving on that, there are the officers, the chair, vice chair, secretary, and treasurer, and then committee chairs, and then we have some at-large members that make up the 12. The executive committee does have to be attended in person. So that happens at the Health Consortium headquarters. And the executive committee is voted on and approved at the board meeting annually. Our joint committee is kind of a separate committee. That one is not appointed by the board, but is appointed actually by the municipalities. The joint committee has management that comes from the municipalities, and then labor representatives. Like I said, each of these have their own quorum. So it's really important for us to have people to attend those meetings. And it's really where labor hopefully gets to learn about the benefits and the health insurance plans. And then management, same thing, gets to learn more about what's happening on the plan side before it goes to the board of directors. Some optional municipal representation, and this is where people can get involved and learn more about how the organization functions. And I will go over each of these in a little bit more detail, but we have the audit committee, claims and appeals committee, finance, nominations and engagements, and operations. Okay, so our different committees, all municipalities are required to have representation on the following committees. That is the board of directors, which I have said that is the committee that is, or not committee, but it's the board that has the responsibility to manage, control and administrate the consortium and all of our benefit plans. The joint committee is the management labor committee. That they have actually a really important role in our health insurance plans, deciding on our actuarial value and how we're going to administer plans to make sure they stay in the actuarial value levels. The municipalities have the option of joining the audit committee. The audit in each of these was gonna say each of these I go into, but this is where I do it. Sorry. The audit committee is the one that only meets annually, one time annually, and they are going over our independent audit, in the independent audit process, which has to go on to the Department of Financial Services. So they make sure that we are compliant, with our annual financial audit. The executive committee is really responsible for the day-to-day operations of the organization. They are the ones that would approve different resolutions of operations, make sure our finances are in shape. And then all of the committees also report out to the executive committee. The finance committee doesn't report every month, but most months it does review all of our regulatory reporting that we have to report every quarter to Department of Financial Services. And then we have an annual report. The finance committee will develop policies, especially around investments and any kind of financial controls that we have. They're also the ones that are responsible for recommending our annual budget and our premium rate increases, and then any funding of any of our reserves. The operations committee is basically what it sounds. It reviews our operations. So we talk about any different kind of policies that we're putting through, might include our cybersecurity, which is really important, and making sure everything's up to date with that. Our operations committee actually has several benefits managers on that. Nominations and engagements only meets a couple times a year, and they help recommend appointments to the different committees and appointments for members to get involved. And then our claims and appeals committee, they meet a few times a year. They review our medical and prescription claims audit. So we do audit our claims administration to make sure that they are being adjudicated appropriately. So that committee reviews the results of those audits. And then if there's any appeals that come through the process, they manage those claims appeals.
Judy, I just wanted to mention the labor component for joint committee. So the chair of our joint committee is always labor, and any labor representatives must serve on the joint committee. And then they could opt to be included in some of these other committees as well. We try to make sure there's labor represented in all of our governance. So all of our committees have at least one labor rep sitting on that committee. And then our joint committee votes once a year on board of directors representatives. So the 10 labor seats for the board of directors has been voted on. I believe we have one vacancy for an alternate director for labor. But so labor always comes to joint committee, and then they can pick and choose how much more they want to participate in the rest of our governance. But I did want to point that out because we really are constantly recruiting to get labor more involved in our governance. So if you are a new municipality and you do have union groups, we would encourage you to have them reach out to the consortium about becoming more involved as well.
Yeah. And making sure that we know of the labor group and have a contact information so that we can make sure that they get the joint committee agenda and stuff. So. And the joint committee is the one committee that doesn't, the board of directors really has no say over who sits on that committee. They really are a committee of their own. They have their own bylaws. And like I said, is a requirement of Article 47. So the role of our board of directors, the most important thing, they approve our budget and our premium rates. That's kind of the key thing that they do each year. They do accept any new members, municipalities coming in. If there's any changes to a benefit plan design, they would be the ones that approve that, do the final approval of that. They elect the executive committee members and our officers. They ensure the fiscal soundness and prudence of our operations. The directors, we encourage them to communicate with the municipality back to their legislative bodies to make sure that they understand what's happening with the consortium. I can say that all of our minutes are on our website, so information is there for anybody who wants to look at it. Transparency is very important to the consortium, especially as we're dealing with public agencies. We really want to encourage that the directors get involved at the community levels. You know, this is ran by municipal and municipal officers, and you know, everybody has a lot to do, but this is really your opportunity to be involved and get involved. And it's the same as every other organization. We have a few people doing a lot, so it's good to try to get some new people involved at different committee levels. And then currently the board of directors meets in August for the educational retreat, which you'll see up in the dark blue corner. The board educational, it is a virtual session, which is nice. That is August 21st at 5 p.m. So that is a virtual, so please save these dates now. And then our mandatory board meeting is September 25th. That is at noon. We usually serve some kind of lunch or something to go with that. That does need to be in person. We have to have quorum in person. Our location for this September is still to be determined. We're working that out. So take that into consideration. And some of, and then the next slide, we've talked about this just a little bit, but as Kylie had said, our joint committee is pretty important. So that's why we want to talk about it a little bit more. We did discuss some of this earlier, but the membership is made up of labor and management. They are working together on recommendations on benefit and plan design. They currently meet 4 times a year. Our first meeting that's coming up in May is when we'll go over our results from 2024 and see where our claims were, see where maybe there's opportunities for education and improvements in our claims. And then we go over the benefit plan design changes. So there's sometimes changes that happen because we need to stay in compliance with the Affordable Care Act, or there's changes that come through New York State mandates that we need to make sure get put into our plans. As Kylie and Elin and such are comparing plans with other municipalities and looking at other plans, we're looking to see where we're losing competitive structure. So we look at those changes. For example, we added hearing aid coverage and more vision coverage to our platinum or our metal level plans. And then this committee is responsible for recommending those plans to the board of directors. And then also notifying municipalities. So this is really where it's really important that the benefit clerks and the directors get involved in the plan design discussions that are happening. And then all plan design changes are effective for January 1st. And then I think the other piece that's really, really important from our joint committee is our wellness program. Kylie spends a great deal of time developing and working with Excelis on our wellness program. Every month, there's an email that comes out with lots of information, different programs that are happening, challenges that are happening, information on how to use MD Live or other programs that are available to each of the municipalities through Excelis or other areas. And then that's something that the Health Consortium sponsors and tries to help with. So if we're doing a challenge like, plant-based nutrition or whatever it just was, and then, we provide a benefit or a prize to people who attend the different challenges. So we're always out of whatever I said, 7,200 belly buttons. We're trying to get more and more people involved in all of our wellness programs. Kylie, I'm going to turn it over to you. You can add anything else that I didn't say that I should have.
No, I think you're doing a great job. No, I think joint committee is really how to get the inside scoop on how our plans are doing, utilization, also developing, plan changes, reviewing, do we need to increase deductibles to stay in compliance with ECH and our actuarial value? No, you don't need to know what those words mean. We do explain it at the committee meetings, I promise. But it is a great opportunity to give you that insider scoop on your own health insurance for you and your employees.
Kylie, I wanted to introduce Brandon Holt. Brandon is with Excelis Blue Cross Blue Shield. He is our representative that we talk to the most. Brandon, do you want to say anything quick to the group?
Yeah, hi. Good afternoon, everybody. As Judy mentioned, I'm the Excelis account manager that works hand in hand with the consortium for the administration, both of the medical benefits and the prescription drug benefits. I've been working with the consortium in this group of ladies. I think this is our 4th year together. So we've been through a lot. We've been working closely together. I'm in constant contact with them. We meet every week. And are probably in contact daily about things just happening behind the scenes with your employees and coverage and a whole host of items. So you have a great team. I think joining the consortium, not only from maybe a financial benefit for you guys, but from kind of a customer service and hands-on perspective, I think you'll be very pleased with the team that's in place with the consortium. I consider myself a part of that team. I'm working so closely with them. So just know that you got a whole team of folks, working behind the scenes for you and for your employees to make sure everything goes smoothly. If there is something that is kind of awry, we're jumping right on it and looking to get it resolved quickly. So, you'll work mostly with the consortium, but just know that me on my side and my team that I have are working, to make sure that the consortium runs smoothly and there's less disruption to members, when they're out getting the services that they need, and make sure that coverage is there. So again, welcome to the consortium. Look forward to meeting you guys. You might see me at some of the various committee meetings, whether in person or on camera. So just wanted to jump on, say hello, put a face to the name, and again, welcome to the consortium. Thanks, Judy.
Okay, Kylie.
Okay, I get to take it away. Thank you, Brandon. All right, so I'm Kylie Rodriguez. Most of you may have already talked to me. I was the resource kind of for all of our new members coming on and with any of your questions, but I am the benefits manager at the consortium. And I really hope that you think of me as a resource and reach out anytime you have questions. So when you join the consortium, you not only join a health insurance, we do have some other services that we provide our municipalities, which I will go over briefly. There is some information coming up too about billing and enrollment. If you're not providing those services at your municipality, we will give you your freedom back to your day. So we will come up on those rather shortly to just free up your time if you don't want to sit through those presentations. If you're a backup or you're doing those services, we really encourage you to stay on. I always say I love questions, so please don't hesitate to interrupt me, put it in the chat. However you want to communicate questions to me is wonderful as well. So one of the services that Brandon honestly kind of did a great lead in for us here is our customer service. So we actually have a dedicated line with Excelis customer service. The phone number is on the back of every member card. They can call Excelis for any questions when it comes to benefits. Maybe they're not understanding a claim. Maybe they received a bill before insurance even paid on a claim and they're wondering why insurance didn't pay, which normally is mail crossing and not that the insurance didn't pay. Maybe they want to check on their deductible, their maximum out of pocket. What is their copay for this new medicine their doctor put them on? All of those questions can be answered through Excelis customer service. And And we actually have this dedicated line because we design our own plans. And we were finding that sometimes our members were winding up with getting a customer service rep that wasn't necessarily familiar with our plans through Excelis. So this dedicated line really helped clear up any of those issues, which is really wonderful of Excelis to offer that to all of our membership. We also have, I used to be the benefits specialist. I just got promoted to a benefits manager, and we're expanding our customer service department here at the consortium and hiring a benefits specialist. So eventually, once we have another staff member, and it's not just me, we will both be available to help you. I don't mind digging my hands in and figuring things out. So a lot of times I have members who may reach out because they just feel like they're not getting anywhere, getting answers to questions they have, or they may have something that's very detailed. Recently we had a big municipality that was going through some pretty big union negotiations, and they had union members who said, for my specific case, I want to know what my cost difference is. We can do claim comparisons. You want to look at your last year of claims compared to a new plan, we can do that. We try to offer as much information and as much assistance as we can to our members as well as their employers. We also post as much information as we can on our website. So on our website, and I'll go over this in a little bit, but we post all of our benefit information, our premium rates, our agendas, our minutes as well, our trainings. So we try to make as many resources available to our members as possible. Plan options, like I was just discussing, if you wanted to look into plan benefits or perhaps helping a union shift to a different plan, we can assist with those presentations. Perhaps you just want benefit education, coming out and doing an open enrollment presentation and going over what's my copay for my doctor, how much is a tier 1 medication. We provide those as well, in person, virtual, however works for your staff. And we do offer a variety of plans. We offer our meta level plans as well as our Medicare supplement plans to our new members. So always a great resource to have. So we try to be as accessible as possible. You are never bothering me if you're calling me, if you're emailing me. I always get that, I'm so sorry I called. You are more than welcome to call me anytime. That's what we're here for. So one of the responsibilities that I have is maintaining our consortium wellness program. So every month we send out wellness emails to all of our benefit clerks, as well as anyone who's subscribed now to our wellness email, which is a great feature. So your employees can directly subscribe to the email and be sent it directly. That doesn't mean please don't forward on the emails. Please forward on the emails. What we find is the more contact, the more exposure they have to the information, the more likely they are to actually read it. To learn, to maybe participate in a challenge. We try to make our prizes worth winning. So Judy had mentioned the plant-based wellness challenge, which was very challenging for every participant who signed up. But great feedback, sharing of recipes, and then the winner got a $100 gift card to Wegmans. We try to make those prizes appealing. We give out New York State Empire passes. We do participation prizes. This year, we're doing our first wellness book club. So anyone who participates is mailed a book for free. And then we read it together and we do discussion questions once a week for 4 weeks. So we try to make the challenges interactive, educational, and rewarding, be it mentally, physically rewarding, or literally a prize in the mail rewarding. We also host Blue for You clinics every spring. Blue for You clinics are available to our meta level plan subscribers and their spouse or domestic partner. This is a free biometric fasting blood draw. And right now it's ongoing for registration. So we have sites located in City of Ithaca, Tompkins County. City of Elmira has graciously offered to be a host this year, which is awesome because we have a lot of new members down that way. So I'm really hoping we can drive up registration there. And Seneca County is also one of our hosts. So these are a great opportunity for your employees or their loved one to get a blood draw done, figure out what their numbers are. The results can be sent right to their doctor. It's done all confidentially. It's just an opportunity for them to know where they stand health-wise. Maybe they have high blood pressure and had no idea. You know, maybe they have high blood sugar and it's something they should be going to a primary care doctor for, but they don't have a primary care doctor. This is some of the feedback we get from employees who are participating in the Blue for You clinics. Our latest wellness email that went out February 3rd included registration information about the Blue for You clinics. Most of them are occurring towards the end of February, beginning of March. So March wellness email that's coming out at the beginning of March will also include all the information to register. You know, it's just a great opportunity for your employees to take advantage of.
So Kylie, they don't have to go to one of our clinics for the blood draw, right? They can also go.
They can go to our offsite clinics through Well Now, but they still need to register through the Integrated Health website link and then just print off a one-pager form and take it to Well Now. And it doesn't bill through your insurance. You won't see a copay. If you're on a high deductible plan, this is what the question I always get to at high deductibles. Well, I don't want to pay on my deductible for blood work. It won't hit your deductible. This is paid for by the consortium as a preventative service. This is not something that's going to result in you paying anything out of pocket to get your blood work done. So I really want to encourage you as a municipality, as a director, to be forwarding on our wellness emails, promoting wellness with your staff. And I know sometimes that can be hard. I work with a lot of DPWs. I work with a lot of people who are on the road. You know, sometimes it's printing the flyer and putting it in their mailbox or with their pay stub to just trying to promote them to participate. Like I said, they can register directly. I've had a lot of luck where, you know, direct emails work better, or our Facebook page, driving them towards our Facebook page to get them to participate and just seeing it in their news feed when they're scrolling through Facebook on their lunch break. We really do try to get as many points of contact as we can when we want to promote, you know, all of the things that can help keep you healthy. So the other piece that we do is we promote all the Excelis tools that are available to our members. The Blue 365, which is a wellness discount program. You can get discounts for gym memberships, wellness equipment, Fitbits, things like that that are available. WellFrame is more of a case service where, let's say you're newly diagnosed with diabetes, you could sign up for the WellFrame app and they can help answer your questions. It gives you a caseworker to talk to about your conditions. We actually just hosted a nutrition and stress management class today, and we promoted WellFrame at the end. There's a whole thing about weight loss and nutrition, and all that knowledge and information is at your fingertips. And the app is free and the access is free. There's also great features with, if you get the Excelis app on your phone, you can have your insurance card right there. We've had frequent college students who lose their parents' ID cards and then are scrambling because they're going to urgent care because they need medicine and they can't find their insurance card. This is a great tool for you to have available to just be able to pull it right up. It's a great way to check your deductibles and co-pays for medications and things like that. So really some great features to our plans as well. And the picture down at the bottom, we love pictures of participation. In March for Nutrition Month, we're hosting a food drive, and the pitch is, please send me your pictures so we can brag about you in our June newsletter. So pictures of participation are gold to me. So if you can send those, we're going to be new best friends on this. Another feature that the consortium offers is CanaRx. So CanaRx is not part of your health insurance. It is a voluntary prescription drug program that we promote to our members, and we pay any member who gets medications through this program. We pay the full cost of the medication. They pay zero copay for their medication. This is a great way if you have employees or you yourself enrolled on the health insurance are on a name brand medication. This is a great way to save on your copays. These are not all the medications they have. This is just my ticket items. These are the ones that I help members find. Eliquis is huge with our membership of being able to get it for a 0 copay versus a tier 3 copay. Same with rescue inhalers, like you may have albuterol, which is Ventolin. You know, getting it in name brand form and not having a copay and being able to have your rescue inhaler when you need it versus when you can afford the copay. Is a game changer for members. CannaRx covers over, I think, 800 different name brand medications. I would encourage you to check out their website. You do have to put in our plan ID, the GTC MHIC, to see our formulary, and then you could see if any of your meds are listed. This is very popular with our retiree population who tend to be on more medications. I recently helped a retiree out in city of Portland that between him and his wife, they're now saving almost $150 a month in copays by just moving some medications over to CannaRx. CannaRx sends you a 90-day supply directly to your door for 0 copay. And if you have any questions on this program, or if your members do, they're more than welcome to reach out to me directly. CannaRx has their own great customer service as well. So you can go online and you can enroll online, and you can even click a button to say, contact my doctor for the prescription. Here's his name and number. Or our less tech savvy people, they can call customer service at CannaRx, who helps them fill out the whole form with them over the phone, which is very handy to have for people who are on the go. So one of the things that Judy mentioned earlier is COBRA administration. So the consortium, I think 2 years ago now, found that some of our smaller municipalities, we all love our town clerks. Our town clerks wear 100 hats. You know, they're filling out marriage licenses while they're helping you do an enrollment form for health insurance, you know, while they're balancing books. So very busy atmosphere. So we were finding that sometimes COBRA notices that have a very timely limit may not have been sent out on time. Not for everybody, but for some of our small groups. So the consortium voted and decided, let's alleviate this added pressure we're giving to our smaller municipalities and offer the service to them, and the consortium pays for that service. So the consortium contracts with Lifetime Benefit Solutions to do all COBRA administration. So what does that look like? So that looks like when you put in for a new hire and you're enrolling them in the health insurance, Lifetime Benefit Solution mails them a COBRA notice saying, hey, you just enrolled in health insurance. Did you know you're eligible if you ever leave coverage to get COBRA? You don't have to worry about sending that notice. Also, if you're terming someone off of coverage, they send the COBRA notice, they send the offer letter. If the ex-employee decides to enroll in COBRA, Lifetime Benefit Solutions bills the employee, collects the premium amounts, does all of that work for you. I did put this in here so you can reference it. So the billing is fun, where Lifetime Benefit Solutions collects that premium plus a 2% admin fee, and then that money is then given back to the municipality, because the consortium will bill you for that COBRA enrollee, and that money that you're getting from Lifetime Benefit Solutions will be used to pay the consortium bill for the COBRA enrollee. And I'm going to pause here because that's a little confusing for some people. Is there any questions about how small group COBRA administration works? Because large group does it on their own, but anything smaller than 50 enrollees is automatically enrolled in this service through Lifetime Benefit Solutions that's paid for by the consortium. Are there any questions on that part? I'm not hearing or seeing any, so I'm going to keep scooting along. And in case you were wondering if you're a small group, you can look up your municipality's name here. All the ones in orange are new small group municipalities that joined the consortium in 2025. So quite a few of you have started up with us, which is wonderful. And of course, we don't see COBRA enrollees that often. So if 5 years from now, you see your first COBRA enrollee, I do not expect you to remember any of this. So you are welcome to call me and we can go over it again. It's no problem. Most people don't want Cobra because it's expensive, but every once in a while we do see them. So the next piece that I'm going to cover is voluntary programs. These are not something that's automatically done for you or included in your membership. These are just optional things that we just want to make sure you're aware of. And if you're interested in the option, you're more than welcome to reach out to me or Elin about next steps. So one of the things we do as a consortium is we're pretty big. And by being big, it allows us the ability to have some negotiating power when it comes to pricing for certain services that we know our municipal members are using. So one of the things that we have is Lifetime Benefit Solutions has consortium pricing for our municipal members on different services they provide. This is not all the services, it's just a snippet. If you want the full list, I can send it to you. But the big thing that I tell new municipalities is get the pricing sheet and compare it to what you're paying now. Is it saving you money or not? I mean, sometimes it won't, but most of the time it does based on what you're already farming out. So if you're already paying for HRA administration fees or FSA fees, this might be a more cost-effective way to go for 2026. So let me know if you want the full pricing sheet. It never hurts to shop around to see where you can save some money for your municipality. The other program that we have a group rate for is EAP, Employee Assistance Program. We contract through Total Care EAP. And right now our pricing based on we have some large municipalities who have joined, multiple small, because this is a great price for them, is at $18.19 per employee per year. So a lot of times they're like, oh, times 12. No, this is times 1. So it's a lot lower rate, which makes it more available for some of our smaller municipalities, which when they go to price it out, it's very high because they don't reach the minimum enrollments. Now, this is just a cost savings. Any contract would be directly through the municipality and the ESI EAP, but let me make that connection for you if you're interested, so we can make sure that you're getting the group rate that we've negotiated with them. A lot of people think of EAP as only being a mental health support. We did a lot of research when it came to different programs, and this program offers everything. It can be financial planning, caregiving, writing a will, where to find camp for the summer. So a great opportunity.
Kylie, I would just add, one of the nice things about this program is it is all virtual. So our members are not, having to travel into Ithaca or a different city or whatever. So everything is available virtually. And it's also has some after-hour virtual options to it. And like Kylie explained, it's not just mental health. EAPs go a long ways beyond that. And as an HR person, I can say they also have great benefits for supervisors and the HR side of things on some avenues of, hey, I've never dealt with this issue before, and they have help that they can provide right online as an employer benefit also.
Thank you. All right. So we've reached the end of part of my segment. Any questions at this point before I turn it over to Jen for billing?
Okay, take that as there's no questions for Kylie. I'm Jen Sandstead. I'm the new finance manager here at the consortium. I'm going to go through billing with you guys. Just going to talk about the procedure, give some examples and some tips and tricks. And bear with me, I'm new. I'm learning some stuff too as I go. So here we go.
You're doing great, Jen.
Thanks. All right, so our consortium billing procedure, basically any enrollment changes that are entered by the municipality or the consortium for our smaller municipalities and made by Excelis prior to the 12th will be picked up in the reports that I run on the 14th. So you want to make sure any changes are done by the 12th. And then Excelis will get them in, and then they will be on your billing. We invoice in full months only. That's really good to know if you're terminating somebody, because if you terminate them on the first of the month, you're going to get billed for the entire month. So if someone is leaving the last day of the month, make sure to end date them the last day of the month, because you don't want to get billed for a full month. Okay. And in order to process our payments in a timely manner, we bill 2 months ahead, which can be confusing, but that is how we do this. The reason is the timing, so that the municipalities that send the consortium invoice through their abstract have time to get the process completed and have the payment to the consortium by their due date. So I'm going to go through a few examples. First one is for a new municipal member bill. The consortium has generated a bill based off of the enrollment census that we received. Bill is sent mid-November with a due date of December 31st. This bill will include the January premiums because we're billing 2 months ahead. Another example. Tom Jones is hired February 1st of 2025. His enrollment form is entered prior to that 12th cutoff date. Excelis report run by me will happen on the 14th. The invoice produced in February is for April with a due date of March 31st. There will be a retroactive adjustment for 2 months, February and March, since you're getting your bill for April. All right, so here's another fun one, kind of explain that retroactive adjustments. Anita Baker is hired on May 1st. Enrollment form is entered June 16th with an effective date of coverage of May 1st. The Excelis report run by me takes place on the 14th. The invoice produced for the municipality is for July, 2 months ahead, with a due date of June 30th. It will not have Anita Baker on it because it got entered after the 12th. The Excelis report run by me on the 14th of June, invoice produced for the municipality for August, due date July 31st, also will not have Anita Baker on it because the entry for her was done on June 16th. The report run on July 14th. The invoice produced for the municipality is for September with a due date of August 31st, and it will have the retroactive adjustment for those 4 months. So when you don't see that retroactive adjustment that first month, it will be coming. It just isn't going to show up until the proper time frame happens. Does that make sense to everybody? Are there any questions on billing so far? Okay, great. So just some tips. You will get a roster with each invoice. The only thing I really tweak on the roster is if there are retroactive adjustments, they'll be pulled out and put on the bottom of the spreadsheet just so it's a little bit easier to see and you don't have to dig through everything to see who that retro is for. On this spreadsheet that you get, you want to look at the contract type. 1 is for individual, every other number is for family. So if there's a long list of them, I try and do a little subtotal at the bottom just so you can see, I had 200 individuals, 80 family, whatever the numbers may be. If you find a subscriber missing or not yet terminated, verify that you have submitted that change via the consortium or Excelis. because we want to make sure that everything is done in a timely manner and process those terminations or changes as soon as you know. Backdated terminations will only be reimbursed up to 120 days. So that's important to keep in mind. Also note, don't ever short pay a bill. Changes that aren't reflected on the current one will be processed as credit on the next billing cycle. We have to bill 2 months in advance. If there's ever any questions, please also feel free to reach out to me. I am more than happy to look into it. I may have made a mistake, so definitely email me, call me, whatever, and we can get it all situated. Okay, so an employee and their spouse should be enrolled in family coverage, not to individual single coverage plans. Medicare supplement plans are the exception. And if the spouse is also an employee, they can each have an individual plan. We also have ACH capabilities. And if you prefer payment in this method versus a paper check, just reach out to me and we can take care of that for you. The biggest thing is the billing rosters are pulled. I tend to pull them on the 14th of every month. They're run on the 12th. So I pull it either the 13th or the 14th, depending on when that falls. Submitting your enrollment changes before that date can really make for more accurate billing. So yeah, if you have any questions, let me know. I'm here. You can email me, you can call me. Like I said, I'm learning all of this too a little bit, so we'll do it together. Are there any billing questions right now? All right.
Seeing any in the chat, so. All right. So I think it comes back over to me. So we do have large group and small group new municipalities. So there's two different ways. Our small groups will submit enrollment forms through the consortium subscriber enrollment portal. Those sheets is what I use to then process enrollments. The portal is found on our website, and we'll go over in a minute where to find it. Our large group municipalities do their own data entry. So they're entering their own data entry into Excelis, but they still have to follow the same procedure of completing an enrollment form and doing all those steps. So we will go over that as well. I did say I'd let you escape. So if you are not doing enrollments and paperwork like that for your municipality, we do understand that your time is valuable. So if you don't want to stay on for this step, you're welcome to leave the training. But if you want to stay on and learn whole bunches of new stuff, feel free to, as I go over kind of our enrollment overview process. So one of the biggest questions I get asked is, can so-and-so be covered by the plan? I think the best example is, can so-and-so cover their grandkids if their child's still on the plan when they have the baby? And that's a no, unless they have legal custody of the baby. So just so you know, only certain people can be covered under the plan. They have to be the employee, obviously, the subscriber, a retiree, or their spouse or domestic partner. We do cover domestic partners, but we leave it up to each municipality to decide if they want that to be available to their employees, because sometimes it does mean an additional expense to offer that to their employees, but we do cover domestic partners. And there is a domestic partner affidavit that would need to be completed when they enroll. Dependents are also covered. So children, natural, adopted, or stepchildren, or domestic partners' children can also be covered under the employee's plan. Of course, we rely on our municipalities to verify those dependents, make sure that they qualify for the coverage. We do have a documentation kind of checklist to make sure that you're obtaining those documents from your employees, if you're not familiar with what they are, to make sure that they qualify for coverage. Another one that I was asked is, can I cover my ex-stepchildren because I have really good health insurance? That's another no, unfortunately. It has to be one of these relationships. And then you have to complete that enrollment form and either submit it to the consortium or process it through the Excelis website to complete that enrollment. Excelis isn't going to ask you to upload birth certificates and things like that. That's the responsibility of the municipality to make sure you're obtaining that documentation and that it is accurate. Every 5 years, the consortium does a dependent audit in which we ask each one of our municipal members to audit any dependents that are covered under the plan to help ensure that we're being efficient with our premium dollars and not paying on claims for dependents who shouldn't be covered under the plan. Don't worry, we're not due for that type of audit for several years, but just a heads up. So our number one resource, your number one resource as a benefit clerk who would be processing enrollment is our website. This is our website, thehealthconsortium.net. And I'm gonna I have some screenshots of where to navigate around our website, but please go on, check it out. You're welcome to read through all of our finance committee meetings. They're not really riveting, but you know, they're there. Sorry, Jen, and Judy. But all of our information is here. We are as transparent as possible. We do post our updated wellness information here as well as our newsletter. Municipal resource tab is probably going to be your home base for a lot of information, finding enrollment forms, things like that. But I wanted to make you aware of our website. So from the home screen, you would go to the municipal resource tab and you would scroll down to subscriber enrollment form portal. You click on it and then it'll come up to another page that'll get you to where the portal is, but then also a list of all of our municipal members have their own enrollment form on there as well. Show you in just a minute. So when you click on the page, this little white box that's up there with the arrow, there's 3 bullet points at the top of the page. You'll see that blue hyperlink for subscriber enrollment form. What you're going to want to do is have the completed enrollment form scanned into your computer, then click in here on this hyperlink to the subscriber enrollment form portal where you're going to fill out the form. It's all your contact information. So if I have any questions, I'm going to come back to you and ask you questions about the enrollment form. And then you're going to upload the document as an attachment. And that goes to our subscriber enrollment form portal. It all comes to me. I get a notice saying it's in the portal. I go and look at the information. I do the enrollment, or if I'm looking at the form going, oh, this doesn't have a date of birth, or this doesn't have a social security number, I will email you questions about the enrollment form. Sometimes those emails are encrypted. If I'm asking you for a social security number or date of birth, I'm encrypting it or I'm calling because I have to protect that PHI information, that personal health information on that enrollment form. It's really important that when you have a completed enrollment form, you're kind of treating it the same way, that you have to protect that information. So you're not going to leave an enrollment form out on your desk. You're also going to file it away, you know, and not save it to your desktop as enrollment form you need to delete later. Just trying to keep that PHI information protected for your employees. So then I know a lot of you are familiar with our enrollment forms. We've kind of done some one-on-ones together to go over filling them out. You know, by now you've had new hires, you've had people leave, we've had to have these talks. But I am just going to provide the overview. So then you can have this video as reference. You'll also have this PowerPoint as a reference, you know, because not everybody hires people every day or terms people every day. And it's nice to have those reference points. So like I was saying, every municipality has their own enrollment form. So this is Town of Groton. They have their own group number. You know, they have the plan the only plan they offer their employees. So when you go to that first tab, make sure you're picking your enrollment form that you're using. And then we'll go over how to complete the different sections of this enrollment form. So I won't be emailing you questions. You'll have it all down and you'll know exactly what to do. So the consortium does only offer single or family. We do not offer 4 tiers, we only offer 2. So if you have an employee who's enrolling them and their spouse, they would be family coverage. Or if you have an employee who's enrolling themselves and their children, they would be family coverage. Everything above one is family for us. So you would want to check the box self or family at the beginning. And then you're going to want to select subscriber status. So are they actively working, or are they going from active to retired? Or are they going to COBRA coverage? Those types of things you would want to designate. Now keep in mind, if you're a small group, even if they're telling you they want COBRA, you would put that you're terming them, and then we leave it up to Lifetime Benefit Solutions to send out that notice and get them enrolled. It's not something we're directly doing at our small group municipalities for COBRA. So real simple, anything in red must be completed, anything in blue, optional. We do have some municipalities that offer a lot of different plans. They may class their people by their subgroup. So if, for example, you have class 101 is for firefighters and class 102 is for police officers, I'm gonna need that information to do the enrollment. We don't have a ton of municipalities who are set up that way, but if you are, then that little blue circle, you would want to put that information over there. So it needs to be signed by a group administrator. I have told people that I won't complete an enrollment without the signature. The reason is this is telling me that you, the municipality, are approving to add this person to your health insurance, which means you're approving us to bill you for this enrollee. That's important. If it's not signed, it really shouldn't be processed because it's telling me the municipality is not aware they're adding someone to their health insurance. We just want to make sure we have it documented that you know you're adding. We also need to know, are we adding them, canceling them, changing them? So sometimes I get these forms and the only thing we're really doing is adding a newborn, but they put add like it's a new hire, and I double check, promise, but it's good to just, if you're changing something, so if it's an established subscriber, then you're changing something, you're adding a newborn, you're adding a new spouse, you're not adding, you're changing. If someone is a new hire and you're adding them to your coverage, you're going to check the box add. Important to select what plans. Some municipalities offer more than one plan, so I'm not going to guess. I'm just not going to enroll them, and I'm going to email you and say, so what plan did you want them in? So important to check that box as well under medical plan selection. Medical effective date. I know we've talked about this with Jen, but most municipalities start on the first of the month after hire. I'm not saying you have to do it that way. And I also know some people have union contracts that say they must start on coverage the first day they start unemployment. That's okay. Just make sure you're telling me when to start them on coverage. If you start them on their date of hire, let's say that's February 14th, you're still going to get billed for the full month of February. It's not anything you need to change right now in a union contract, but something to keep in mind, maybe next negotiation, we should shift that to match. So we're not paying for a plan that is only coverage for 14 days. Just cost efficiency there. So under section 2, I pretty much need all of this information. If you leave off Social Security, I can't complete enrollment. If you leave off date of birth, I can't complete enrollment. The name should be their full legal name, not a nickname, or, you know, you put down Ron, but their full name is really Ronald. That will affect a claim not getting paid on the back end if we're not using their full name. Street addresses are important so we can mail them their cards. If they have a PO box, that's okay too. Just make sure it's accurate. Email addresses are handy. Phone numbers. I have a lot of people who put down their work number. If they put down their work number, we don't have a way to get a hold of them once they retire, or maybe they don't work in that department anymore. Why would a health insurance need to get a hold of a member? We've approved your prior authorization for PT. Health insurance can't reach the member to let them know. We didn't approve this specialty medication. You should call your doctor to make another appointment to discuss options. Couldn't reach the member because we didn't have a phone number. Or an outdated address, their cards don't get to them. Things like, it's important to keep that information updated. So if they're updating, if they're coming to you and saying, hey, by the way, I'm moving, and you update it in their personnel file, you should also be letting us know that their address updated so we can update it with their health insurance. Just important points here. And I know this is gonna sound silly, but we had a whole training about it. Make sure you're reading the forms. If you can't read the handwriting, once it's scanned and sent to me, more than likely I can't read it either. So if you're wondering, is that a 6 or an A? Ask the member before sending it on over, just to make sure that there's not a lot of back and forth trying to figure everything out after the fact. So this is where you would check in section 3, what are we doing? Is it a new hire? Are they changing plans because it's open enrollment? Are they making a change because they're Medicare eligible? Unless the member is a new hire or completing an enrollment form during open enrollment, they're gonna have to have a special enrollment period to make changes to their coverage. So what is a special enrollment period? That is marriage, divorce, death, birth, change in employment status. They've lost coverage from a previous plan, be it Medicaid, be it Fidelis, like Family Health Plus type plan, be it maybe they're covered under their spouse and their spouse is no longer covered by their employer, so they need to pick up yours. That's involuntary loss of coverage. So those are special enrollment periods where we can change them outside of open enrollment. Section 4 on the form, this is where we cancel people. So we can terminate someone at any time for coverage. If they come to you spontaneously and say, you know what, I'm tired of paying my health insurance, I'm healthy, I don't need it, term my plan. We can do that. You can send us a termination and we can end their coverage. Now, 2 months later, when they say, you know what, I just found out I have diabetes, can I get my health insurance back? No, because you voluntarily left coverage. You didn't involuntarily lose coverage. So important conversation to have when someone's saying, I don't need it anymore, I don't want to pay for it. They can leave, but they can't come back until open enrollment, which means waiting till the fall, then starting January of the new year. So just something to consider. We typically end coverage at the end of a month, because you're getting billed for it anyway. If we end them February 7th because, you know, they quit and never showed up to work again, we can do that, but you're still going to get billed for the full month. So a lot of times we carry the coverage through till the end of the month, allows them time to get other coverage, and to get their COBRA notice in the mail and things like that. But that's typical. But whatever you write on here is when I'm going to term it. So if you know that they want coverage till February 28th and you write March 1st on here, that means they have coverage in March till March 1st. So you want to make sure to put the last day of the month for coverage. And reason codes, you do need the reason code when you're entering this into Excelis. So did they leave employment? Did someone pass away? Removing dependents. Sometimes it's due to divorce. Sometimes it's due to my adult child got their own job and they're on their own health insurance and I want them off mine. That's okay. You know, we just need to know that you're requesting to remove them type of thing. So just putting in the reason codes there. This whole key is on the form, so you don't need to memorize these codes at all. So section 5, this is where we add the family. So adding a spouse, domestic partner, you know, you're going to make sure you're checking those boxes of what type of dependent they are. You also, and I know it says last name if different. So if it's the same last name as the subscriber, it's meaning don't put it in here. I really like it when you do, so I don't have to guess. That way we know we're getting the right last name. You know, we know that that's gonna be their accurate name for their ID card they're gonna be mailed. Knew a couple years ago, it was mandated that every dependent on a health insurance plan gets their own ID card. So, when you sign up a family of 8, every single person who signed up for that plan is gonna have their own ID card. Which is actually really helpful. You know, I work with a lot of employees who might be divorced and they're like, "Oh, I need another set of the cards for my kids." Very easy to order that. You just send me an email and I can order another set of cards. It is very easy to get new ID cards if people lose them, need an extra copy. Some just like to have an extra set in the safe just in case. Not very difficult to do. They can call Excelis customer service, order it. You can order it right off their app if you have an account. Reach out to me, however you want to do it. We cover dependents up to age 26. So when you're enrolling a dependent, you have to make sure they're below age 26 unless they're a disabled child. And then we would need all of their information completed here. So first name, last name, social security, date of birth. You're not refilling out the address. Dependents don't have a different address than the subscriber. Everything goes to the subscriber's address. Section 6, which most people skip, is all about other coverage. So this section would need to be completed if, let's say they're going on your work insurance, but they're covered by their spouse as well and keeping that. We need to know about the other health insurance. So Excelis can set up a coordination of benefits. Coordination of benefits means who pays first. So in this situation, Excelis us would pay first because the subscriber, that's their primary, and then the spouse's coverage is secondary. But we need to establish that coordination of benefits. And if it's not set up, they get a nice big long form in the mail that they're asked to fill out as well. So it's easier to kind of do it this way. The other reason you would fill out this section is an employee comes to you in April and says, I lost my health insurance. I need to pick up ours. This is where you document the previous health insurance. So we know when it was effective, when it turned, what's the ID number, and what carrier it was through. Those are the bare basics we need out of this. And a lot of times all we get is they were with MVP and it ended. We need the details because without it, I can't complete the process on the Excelis side. And so I'll be coming back to you asking for it. So just a heads up that that's what this section is for. And then make sure the subscriber signs it. That's them agreeing to join the health insurance. I say that, but if you have someone who never shows back up to work, how do you get them to sign their termination notice? You know, I understand that not always you can get it signed, but for anyone new to health insurance, they should be signing this. Anyone who's adding a dependent, such as a newborn or a spouse or what have you to their health insurance, they should be signing it. It's them agreeing to sign off on that they're willing to have that done, willing to have that addition made or change made. But if they left employment, never never came for their last paycheck type deal, you can't get a hold of them. I understand that not all terminations are going to be signed by the subscriber. So steps for submitting to the consortium portal. So you're going to scan the enrollment application once it's all completed, have it in a PDF format. Then you're going to log into the portal, which is clicking that link to our subscriber portal on our website. Then you're going to upload the enrollment form you have and fill out the form so I know who's sending it to me in case I have questions. And then you're going to hit submit. And it's directly sent to me. And it's through a secure way to protect that PHI confidential information that all enrollment forms contain. Once I receive it, up to 3 business days to receive an email back of confirmation. I'm not going to lie, I don't wait 3 days to process them. You will get an email within about a day or less. But pretty basic steps to get everything to me. I do not need birth certificates. I do not need marriage license. I just need the enrollment form. This is something I like to tell everybody about because age notifications for small groups come to me, but you're still gonna see them because I scan them and send them to you. Age notifications come from Excelis whenever a member is turning 65 or turning 26 if they're a dependent. We automatically term all dependents at age 26 on the last day of the month they turn 26. And there's nothing we need to do. It's automatic with Excelis. We don't need a termination form. We don't need you to tell us to term them. It's all taken care of. When the big thing is we ask you to make sure the employee is aware, because not always are they necessarily thinking, oh, my kid's turning 26 and they're coming off my health insurance. They're thinking, oh, they're turning 26. So just so they're aware that that 26-year-old should be shopping around for health insurance to make sure they're covered. Our large groups get these notices sent directly to them. So knowing what to do with them is important. So when they turn 65, what do you need to do? If they're an active employee, our coverage is primary. And even if they pick up Medicare A and B, which they don't have to, it's not primary, it's secondary. Now, if they're a retiree, it's different. With a retiree turning 65, Medicare becomes their primary coverage, and then we are secondary coverage. The other thing with the age notices for retiree classes only, this is only if you're doing the data entry. With retiree classes only, you're going to go from an under 65 class to an over 65 class. And that's something that you have to do the data entry for. So for small group, I do it for you. For large group, you would be entering it yourself. I'm still going to let small group know because I need the Medicare information to make that shift to the over 65. So when you get these, if you have questions, you're welcome to reach out. Small group, I get them, I email you, I kind of give you some instructions with the email. Large group, you will be getting these in the mail. Some of our large group municipalities have rules that once that retiree turns 65, they come off consortium coverage and go on to something else, or just come off entirely. Those are all things that this would help you keep track of. So you're not keeping a separate spreadsheet of who's turning what age when. Any questions on age notification or the enrollment form, where we kind of talk about div and retiree classes? Start. Seeing none, hearing none, I'm gonna move on. So active and retiree class. When an employee's active employment, they're under what's called, we call it A class, active class. And then they would transition to retiree class. When they retire, they're no longer an active employee, and we call that R class. It's important that we make that move from them from active to retiree. In the past, we've had municipalities that just leave everyone in active class. Just easier. There's less work. There's less paperwork. We understand that. But why move them? Because it's important not only for coordination of benefits. So when someone retires and they maybe pick up another job and they're covered by that health insurance, that active health insurance should be primary and retiree coverage should be secondary. Or maybe they have Medicare. Well, if they're retired, Medicare is primary and our coverage is secondary. But if you still have them listed as active, then our coverage is primary and Medicare is secondary. Why is that important? Well, for a retiree, when Medicare is secondary, they pay a bulk of the medical claims. When they're still on active and they should be retired, the consortium is paying a bulk of their medical claims, even though they're retired, and Medicare should be paying a bulk of their medical claims. And that's just efficiency, making sure that the claims are running efficiently and we're not paying for claims that we shouldn't be paying for, to make best use of the premium revenue to pay for our claims. because we are self-funded. So all the money that comes in from premiums goes right back out to claims. So making sure we're being an efficient organization. In that way, we rely on our municipalities to communicate this move from active to retiree to us. And then the over and under 65 that I talked about, I assist small groups with that. Large groups would be the responsibility of them to process that, but you will need their Medicare information to process that shift. And that's just how we keep track of how many under and over 65 retirees we have. And it's for certain reporting purposes that we have to do to CMS as well. So I know this won't apply to all of our small groups, but it is good to know for our large group how to move a retiree from active to retiree class. You're not canceling the active coverage, you're changing it. So this is kind of where the windows from Excelis would come up and you'd be able to view. I think this is nice for small groups to see what I'm entering and how it's done. We always shift retirees at the first of the month, even if they retire sometime in the middle of the month, because it creates billing conflicts if we don't. It creates duplicate billings where they look like you have someone on active for half the month and then someone in retiree for half the month. So then you get billed twice for the same human being. We don't want to do that. So we shift retirees at the first of the month. We put the retiree date in there, but we shift them at the first. And then of course we want to, on step 3, we would click that we want to change and add, and we'd move them to the R class instead of the A class, which is the last 4 letters of the group number. And then we want to enter that Medicare information to make sure we're setting up that coordination of benefits. For a while there, we were having multiple phone calls. I was with coordination of benefits issues and things like that. I know how to fix it. It takes time. And in that time, people see doctors and they have medical bills. And then you have to go back through with every provider and fix their billing. So it's best to fix it on the front end than wait for an issue on the back end. So this is a lot of preventative care because they don't call me first. They call their municipality. They call where they retired from with their issues. And it's preventing those phone calls from ever having to come to you with an issue. I'm normally the second or third call. And by then we have lots of claims to fix. So this is just a process that I wanted to make you aware of to prevent issues for you and phone calls for you. So, and when I send you this slide deck, all of these are hyperlinked, I promise, to take you right where you need to be on our website. So that acts like our benefit enrollment forms. It'll take you right to the page that has all those. Portal, our subscriber portal for uploading enrollment forms. Our plan benefit summaries are up there. Each one of our municipal members has their own landing page where your benefit summary, your summary of benefits, your co-pays for your medications, the current drug formulary, it's all on your landing page. We welcome you to share that with your employees as a tool, a reference. It's nice to have. We update each one of them every year when we update our benefit summaries. So it's always current. We also have our premium equivalent rates. If you ever want to look up our rates or metal levels or things like that, it's all there. We try to be as transparent as possible with our information. So we are a small staff, but we are mighty. I'm sure Judy would agree. So right now we are a staff of 4. We're looking to hire a benefit specialist within the next month or 2 to expand out our customer service and our benefits department. And even though we're small, we're very efficient. This is all of us. As Judy kind of introduced at the beginning of the presentation, and I'll turn it back over to her in just a minute. This is all of our direct emails and our phone numbers. Don't hesitate to reach out. I get called a lot for billing questions. I can't answer them, but I can get you to who can. So don't hesitate.
And
And
just
Judy, I'll turn it back over to you.
one thing, and we will fix this, and I just noticed it. My phone number is wrong on this, so we will get the right number on it. So you guys have the updated phone number if you need to call me.
Thank you, Jen.
Great, thank you, Kylie. Thank you, Jen, for that update on the phone number. And Kylie's right, we're hopefully going to be adding a 5th member to this staff shortly here. It is really impressive on how much this group of 4 accomplishes for an organization as large as the consortium is and growing. So I want to thank the staff because they are an excellent group to work with and really care about the consortium and our customer municipalities and our municipalities employees. So appreciate that. Like Kylie said, this slide deck will be coming out to you. So you have all these resources and information available to you. Call us, email us if you have any questions. Don't hesitate. It's easier for us to get in front of something than trying to dig us out of a hole. So we hope that, again, you will get involved. If you have any interest in any of the committees, you're certainly able to view any of the committees, read the minutes on the webpage. If you want to attend one of them via Zoom, you can reach out to Lynn and get the Zoom link information for that committee. And we just really hope that you will, join us for some of the committee stuff. Make sure that you have those save the dates for our August educational meeting and then our board of directors meeting in September. Those are crucial things to make sure you have on your calendar. So like I said, just reach out to us if you have any questions, and thank you for your time today. We really appreciate it. Anything else?
I think so. So, and I didn't see any questions in the chat or anyone raising their hand. So I think we're all set. Thank you
All right.
so much.
Thank you.